A 49-year-old inmate became the first American prisoner to die of the coronavirus, setting off alarm bells for jails and prisons nationwide. Louisiana, which has seen a spike in COVID-19 cases spanning the state, is one of several that has released nonviolent offenders to ease crowding and, it is hoped, prevent transmission of the virus. New York City is doing the same. Officials in America's biggest city say stopping the spread of the coronavirus in jails is an urgent priority. More than 200 inmates and corrections workers have tested positive for the virus, prompting the mayor to order hundreds of inmates released.
Individuals convicted of offenses such as misdemeanors and nonviolent felonies. So when we looked at that category of people, there's over 500 inmates in that category.
In Chicago, judges are deciding on a case-by-case basis whether hundreds of inmates can be released. But in politically conservative Texas, the governor is halting such releases amid pushback from the public and some authorities.
I've heard from law enforcement officials as well as citizens alike who have raised concerns about releases that have already taken place or anticipated releases that could take place of dangerous criminals in jail because of COVID-19.
U.S. Attorney General William Barr directed the Federal Bureau of Prisons to move sick and elderly inmates to home confinement. Non-governmental organizations want other inmate groups released.
To drastically reduce prison populations so physical distancing becomes possible, they should also consider releasing low-risk offenders. Imprisonment should be a measure of last resort, particularly during this crisis.
The head of the U.S. Federal Prisons Workers Union wants the government to stop all inmate movements for at least 21 days. The Bureau of Prisons says it will force all new inmates into 14-day quarantines. So far, confirmed COVID-19 cases among federal prison inmates and staff numbers in the dozens. Chris Simkins, VOA News, Washington.